regular health, and success. The first question I want to ask you is, what makes you different than other dentists?
The fact that I don't only practice dentistry, I practice medical wellness, I practice advanced genetics and biology. I have involved myself in the full gastrointestinal tract. That means that from the oral cavity all the way to the exit point, where the medical exams, the blood tests, the intolerance exams, the actual allergic tests that we do for both food and environmentals will complement the type of nutritional lifestyle that I want for our patients, that not only entitle themselves to a healthier lifestyle, but also understand the purposes that even though we look alike, we are not built genetically equal. And then looking from the perspective of dentistry, the orthopedic position, the neuromuscular position of the bite of the muscles and the jaw, and at the same time, the full profile of facial contours as compared to your height and body composition. All of this is part of what I normally do on a daily basis. So I am not your regular dentist.
When did you decide you wanted to give people the smile of their dreams?
It's not a decision, it's actually an oath that once you see somebody that could get the very best version of themselves, that they can actually not only look better but feel better, that you bring back that security, that you know that they're gonna be more radiant, that you know they're gonna be more assertive. You know that by them feeling amazing, they will only shine, rise, and be part of a society that normally tends to put people down by how they look, forgetting about how the people feel, making you feel amazing, making you look great. We will be the stars of the show at any moment in time.
What components does the Dr. G whitening toothpaste have that help you whiten your teeth?
The most important component of my formulation for the whitening is the anti-sensitivity and the component that reduces any type of cavity in the patient's mouth. Because at the end of the line, it's not about making you look good, it's about making you feel healthier, and look also can be deceiving over time, right? So the fact that they contain the different whitening products, be it peroxide, carbamide, or hydrogen peroxide, and the concentration that is perfectly balanced, it's not in my books as crucial as the components not only giving you the right results, but also be part of a healthier lifestyle. That is what sets my components apart from the rest.
How does the blue light combined with the Dr. G whitening kit gel help you change the color of your teeth?
The molecules of the components of the whitening toothpaste will become activated and will actually be like rampantly moving in and out faster. It's almost like a turbo boost to any engine or a supercharge to an engine of an automobile. You'll make things be accelerated without producing the extra heat that some lasers or the extra heat that regular power lamps would actually use, producing more sensitivity. The combination of the power lights do work, the combination of the lasers do work, but when you combine the biochemistry with the light activated LED, it gives the patients the best results.
What is one habit that can change your entire life?
Prayers. Because it doesn't matter how you look, it doesn't matter how you think you feel. If you're not praying enough to share the love, to share the quality of caring for other people's well-being, you may find yourself alone in the world. It doesn't matter who you are, it doesn't matter what you do, it doesn't matter what possessions you have. Being alone is not God's plan for anybody.
Is there any food that can help with your teeth?
For sure. There's a diversity of food types in the different pyramids that can actually help you, but the apple is one of the ones that would actually help you clean the plaque from the teeth. But you gotta be careful because, for instance, I am allergic to apples. If I start chewing on an apple, I'll have like peels in my mouth. So you have to always remember what may be good for somebody may not be that good for somebody else. Some people use like lemon, lime, and they just brush their teeth with the lemon and the lime. And yes, it does help you clean your teeth, but it's an acid. So it actually helps by removing the tartar, by removing the plaque, but over time it will destroy your enamel. So some things need to be used and understand that yes, some food types may actually stain your teeth, like carrots, like maybe like some greens, some dark fruit, dark drinks. but nothing replaces toothbrush, nothing replaces a proper toothpaste, water pick, and a floss technique.
Mints. Good for the breath, bad for the teeth. Why?
The fact is that you should never have bad breath. If you have bad breath, it's because either you have periodontal disease, gum disease, which is an inflammation of the gums that produces bleeding caused by a bacteria and a substrate of food that is called plaque accumulating in your gums. Maybe you have a cavity. Maybe you have missing teeth accumulating plaque in between your teeth. Maybe you have bad breath coming from your tongue that has deep crevices that produce a volatile sulfur. That this is what causes the bad breath. Maybe you have gastric disturbances, and then you have acid reflux producing this bad breath. Don't hide the bad breath with the mint. Find the cause, and if it's something that is systemic, take care of the condition. If it's something that is local, do a good oral hygiene, do x-rays, make sure that you're properly on point with your smile and your health. That's the key to avoiding the embarrassment of having a bad breath or to feel neglected, that you have something that takes people away from you.
Is it bad to brush your teeth very harshly?
Indeed, anything that you do very hard, like if you kind of like wash your hands really, really hard every day, at one point you're gonna create friction. Friction creates heat, and this heat over time, it's good for you, but it starts taking away some of these layers of your skin. Well, if I do it on this side, it actually be more dangerous than if I do it on this side because of the thickness of the skin. If I brush hard, for sure over time you're gonna either injure your gums, or that you may slowly over time remove your enamel, creating crevices in the enamel or creating very harsh sensitivity. So gentle brushing, constant technique is the best. If you use an ultrasonic toothbrush, it's actually best. And don't put pressure on the toothbrush. Once the bristles open up, it's time to replace.
What does it mean when your gums bleed once you floss?
There's a few reasons. Reason number one is don't be violent. Gums need love and care. That means precision, technique, or precise technique to be gentle enough to loop around the tooth and to be able to floss up and down and slide it out, right? But if you're bleeding, you may have a vitamin deficiency, you may have an underlying condition. A lot of people that have diabetes, or people that have taken medications for blood pressure, for cholesterol, medications for, say, medical conditions, could produce vasodilation and blood vessels, instability of bleeding. Some people have periodontal disease, gum disease, they have gingivitis. Some other patients actually have a very low immune system because they're taking medications or they're under chemotherapy, radiation therapy, anything like that. Healthy gums don't bleed and they are pink in nature, or depending on your genetics or your ethnicity, they may be a little darker, but they will never bleed.
Is everybody a good candidate for veneers?
Not really. The question is, how's your bite? How are your teeth? Are you healthy or not healthy? What is the purpose of getting veneers? Cannot you do whitening? Do you need to actually have added prosthetic restorative materials to be able to look your best? Some people have grinding, brushing, clenching, or a combination of the three of them all. Some people have very hardcore grinding that produces multiple fractures of the enamel that they do require veneers because they don't qualify for whitening. Some people may require more than veneers, crowns, three-quarter crowns, onlays, inlays. At the end of the line, x-rays, 3D scans, photographs, intraoral camera exam, all of these are vital in the purposes of that discovering whether you need veneers or not, or whether you want veneers or not. You have to create a balance, health and happiness. But you have to be able to maintain them.
What age is ideal to get veneers?
We have patients that are 6 years old that they have some veneers because of accidents. They could be done with direct composite veneers, protecting their nerve. Some people break a tooth and they're 4 years old. You need to do some cosmetic dentistry. Little speaking, veneers is just an added on material, whether it will be lab made or directly done by the doctor in the office. The factor is that sometimes you have diseases in the patient's teeth, like kids that are born with enamel deficiencies or dental deficiencies, kids that grow with the baby bottle syndrome, or kids that have high sugar intake, that the enamel is completely eroded. You need to do cosmetic dentistry because the long-term detrimental emotional support will not be there if you don't look good, if you don't look healthy. People will be doing a lot of jokes about you, they'll be bullying you. So there's no really age limit. The question is, what's the cause? What will be the consequence of doing veneers on somebody so young that don't understand the maintenance requirements or the negligent behavior that will produce more cavities, destroy your teeth, gum disease, or anything like that. Age factor is not necessarily important. What's important is what is the cause and why.
What are habits that can make you millions?
The question is, what are your needs in life? I mean, you could be a very healthy, prosperous fisherman in a little villa and be the happiest man alive with your family together and your kids surrounding your farm, and you wake up to the beautiful sunshine that you don't need an alarm clock because you go to sleep when the sun sets. I mean, there's a lot of reasons why millions is not the answer to anything in the world. But if you get sick, if you need to accommodate better education, if you need to invest in farming, if you need to invest in better fishing tools, if you need to invest in like perhaps even chemicals to be able to cure your plantation or your fishing tank, then you need some financials. And now, how big your desires are, how big your goals, and how hard you have to work. And always remember, the millions will come with a lot of benefits, but a lot of sacrifices. What are you willing to give up to accomplish those goals?
At what age is it ideal to start working out?
I believe that we have athletes that they start working out since birth. I mean, I've seen a lot of parents that they convert their children into mega athletes. These are the ones that go to the Olympics. These are the ones that are always competing. The key factor is not what is the age to make you athletic. The question is, what are the limitations that are not going to cause growth defects, that are cause damages to your ligaments, damages to your articulations, damages to your bone, muscle, tendons, that you're not going to have unsustainable injuries, or you're going to have injuries that are sustainable, that you're going to grow out, but you're not going to have long-term damages when you're older, that they don't boost a lot of metabolic enhancers, that they don't put a lot of steroids into making you stronger or making you faster, or they don't use cheat codes to be able to make you a winner. Nothing that was not given by Mother Nature in the name of genetics can or should be used in any children, because you may have consequences later on. Kidney, liver, pancreas, circulation, and so forth. So just be careful. Working out, calisthenia, working out with your own body, lifting your own weight is actually eternally beneficial. But when you push the system to do beyond that, that you want to be able to compete, you need to understand that you need a coaching system that is going to protect your parents, perhaps medical doctors, physical doctors, and somebody that truly cares for you beyond the athletic department.
How can your relationship change your life?
Self-love. I mean, if you love yourself, you respect yourself, and you set boundaries to protect that self-love, and you surround yourself with the right circle of people, and you have good family values, and you truly care for your parents as much as you may wish your children to take care of you, you need to lead by an example. So if you're taking care of your parents and you're visiting your parents, and you're taking your children to see your parents, which are their grandparents, you hope that one day you'll be served the same way. So self-love, it's probably the best way to enjoy life, and don't neglect that ever.
Is the law of association a real thing?
Look, the law of attraction, it's almost like a magnet that people say positive with positive will repel each other, and positive and negative will complement each other because they bind. It's like polarity, right? If I'm putting in a situation myself where I am attracting wellness because I am giving myself wellness, and my core values dictate that I need to eat healthy, that I want to be surrounded by healthier and healthy people with a lifestyle that engages me into be more spiritual, and also being more pragmatic about what I don't want, which is called my non-negotiables, then I will definitely attract that in my close proximity. So the law of associating yourself with the right people, with the right food type, with the right environment, does provide that momentum that keeps catapulting you into leveling up. Because at the end of the line, we need anchors that keep your feet grounded to the ground, so that you always go back to the family core values, so you always go back to your spirituality. Because sometimes when you get distracted from this, because you're attracted now to something that is extremely invigorating but may not be leveling you up. If you don't have mutual levels of together or as a group rising, and you're feeling that you've been left behind, maybe you are not doing something to push yourself up with the circle, but maybe your circle is not the one that you need in your life. So keep in mind, attracting what you desire and pushing towards where you want to go is a hard commitment that you cannot give up. Always work towards accomplishing your desirable, realistic goals.
How do you become the best version of yourself?
By not thinking that you are ever gonna become the best version of yourself. It's constant evolution. And by having a constant evolution, you always reading your inner mindset to see if I am not fulfilled, but I feel good, then what is it causing me to wanna get better? That urge to always wanna level up your emotions, level up your health, level up your desirability to continually grow. It's kind of like never finding the peak to the mountain, never finding the deepest oceans, never finding the darkest of the dark or the lightest of the lights, because you're always gonna know that there's something always passing that page and continue exploring the beautiful journey that God gives you until that it's time's up.
How do you deal with haters?
I don't know what that is. I don't think that I have that in my associated languages. It's not part of my law of attraction. As a matter of fact, thinking about negativity or thinking about the word that I was just questioned about, it's a distraction to core values, to principles, to God's love. And anything that deals with that type of negligent anchor is probably best to let go of the rope that holds the anchor. So it's not part of my vocabulary. It's like it doesn't exist.
What would you tell yourself if you could go back 20 years from now in the past?
Nothing. Enjoy life. Push harder. Don't give up on your dreams. Be more persistent. Keep those goals that you wanted to do, and with what you know already, don't stop having fun in life. Whatever you have done so far, you got yourself there. Where do you want to go 10, 20, 30, 40 years later? So the same guy looks back and says, I am proud of you. And if I go back to the 20-year-old guy that I was back there, I'm proud of you. Keep it up. So my goals for 2024 are the same goals that I have for 2023, 22, 21, and since 19, whatever, that I have the memory of independent field associated principles for my own life. And that means always stay healthy, always stay vibrant, always stay ahead of the game. And we have a lot of personal goals. That means a lot of reading, a new book coming up. I have a collection of ideas that I have already began at the delegation with the right processes to audit the results of the people that work with me. I have a significant appreciation for what I've done so far, and I want to multiply that. And unfortunately, what's going on in the world assures me that I need to be very conservative in 2024. So I am moving forward with what is called systems and operational manuals, because whatever you don't do now, that doesn't mean that you don't do it later. The key factor is roll to 2024 because it's a year of preparation for what's coming up. It's gonna be great.
Since you have seen the dental industry change through a lot of time of experience, what would you say was the most impactful thing that has shifted?
Most dentists are very conservative. As a matter of fact, I was talking to a few dentists over the weekend, and they asked me a question very similar to that. And I said, never believe that the education that you receive at the university is what's going to take you to the highest levels of practice management or delivery of the utmost of best dental services to your patient population. But again, what I've seen as a new trend in dentistry is doctors of the dental field forgetting that what is called minimally invasive dentistry, which is called microscopic dentistry, which is what I co-founded an organization many years ago, which is called the World Congress of Microdentistry. I'm one of the founding members, I'm a fellow member, where we use the most minimalistic approaches to be able to restore the patient's mouth under the least amount of invasion, with the most amount of care, and the most comprehensive medical, biology, genetic, and orthopedic functional dentistry that one can assure a lifestyle of progression towards a healthier and wealthier lifestyle rather than a facade of looking better but unsustainable over time. And again, dentistry has evolved in terms of science and technology, dental procedures that have advanced in terms of materials and techniques for cosmetic dentistry. They are combining 3D computers with imaging for orthodontics, orthopedics, aesthetic dentistry. It's amazing because it makes you always be connected to the world of technology. Nothing and nothing will ever replace the factor of human care and the true caring of the doctor, staff, and patient relationship. That is a bond that is based upon trust, but unfortunately measured by results.
And now for the last thing, I want you to tell all your viewers one thing that you think they should start doing tomorrow to change their lives.
Look, if I had to tell you what you need to start doing tomorrow to change your life, I already did it. You gotta start thinking about it yesterday. Yesterday is the day where you plan what you are actually supposed to do today, like right now. Do not follow the leader that says, oh, don't wait for tomorrow what you can do right now. You should have done it yesterday. Life is about planning, but also life is also about being able to adapt, being able to manage the adversities or surpass your own goals. If you're reaching your goals, you're not surprising me. If you are conquering normality, then you're part of a conventional lifestyle. But when you are ahead of the game of yourself without doing no comparison, you don't need to think about what you need to do tomorrow. Anything that you do is based upon the principle of personal satisfaction and the ability to be able to sleep every night in peace. Preparation is the name of the game. Never give up on your dreams, but always remember, you may need to have somebody to tell you how you're doing because everybody needs a coach at points. Don't think that by doing everything yourself and independently, maybe you may not be doing it either as efficiently or as good enough or as you're supposed to do. So keep in mind, being part of a circle of invigorating people in any field of the world would need you to be able to push to level up.